The answer is no. It depends on the severity and the nature of the coronary blockage, and we tend to be very much guided by evidence on when to use coronary angioplasty and when to advise other treatment. Not all blockages need to be treated by angioplasty. Some blockages are only very mild, less than 50%, and in those instances we typically do not treat with coronary angioplasty, and a patient can do just as well in the long term with a medication-based approach to treat the blockage. We can also assess a blockage with more advanced techniques. We can measure the pressure difference across the blockage. We can use a camera called intravascular ultrasound, and if the assessment and the information we get about the blockage from these modalities suggests that the blockage is not significant, then we can also get away with not treating with angioplasty but continuing to treat with medication. If, however, the converse is that we have multiple or diffuse blockages, or the blockages are in critical locations within the coronary arteries, then sometimes it's in the best interest of the patients not to treat with balloon coronary angioplasty. There may be many stents are required. Angioplasty could be high risk, and therefore we tend to advise the patient to have coronary artery bypass surgery, which is a treatment which is open heart surgery, and that allows the surgeon to place bypass grafts, typically arteries within inside the chest or veins explanted from the legs, from the veins of the legs, and they are used as bypass conduits to provide blood supply to the heart muscle beyond the blockage. And sometimes we advise patients to have coronary bypass surgery. That tends to deal with all the blockages, and sometimes if there are many complex blockages in a patient's heart arteries, it's best for them to have bypass surgery rather than multiple stents, a long coronary angioplasty procedure, which has risks because of the dye, has risks because of radiation exposure, has risks because of just generally, the blockages can be more severe and more complex. It's better in the long term for that person's outlook to have bypass surgery. Allergic reactions to the dye have been described, and we often ask patients as part of our pre-angiogram or pre-angioplasty checklist whether people have a reaction to iodine or seafood. Some people may have had a reaction to previous CT scans where they've had dyes for other parts of their body. Typically we can limit the risk of a reaction to the dye by giving people hydrocortisone or Pyriton, which is an antihistamine, as a pre-medication to reduce the risk of a dye reaction.